Welcome. My name is Leanna Levine-Reisner, and I am the co-founder and network director of Plant-Powered Metro New York. We are an organization committed to your empowerment, helping you access critical information about how what we eat impacts our health. But we don't stop there. We want to help you make change in a joyful and sustainable way. Tonight, we are unpacking a very complex question. What if nutrition could influence our risk for blood cancers or even help improve outcomes? We'll hear from our presenters the latest fascinating research on multiple myeloma, lymphoma, leukemia, and related conditions. Blood cancers can feel especially frightening because they're often hard to detect early on, they're complex to treat, and they may be aggressive and prone to relapse. But research insights can help us learn strategies for reducing our risk of these cancers in the first place, while also giving us evidence-based approaches for using food as a source of strength during and after treatment. Tonight, we'll start with a look at ongoing studies out of Memorial Sloan Kettering Cancer Center on multiple myeloma, and then we'll broaden the discussion to learn about the interplay between diet and lifestyle and the treatment and prevention of other types of blood cancers. To answer these important questions, we're so pleased to have an esteemed panel of healthcare professionals, including registered dietitian Francesca Castro, Dr. Keyur Thakar, and Dr. Tarun Wasil. Throughout the program, please share your questions in the comments, and we will return to these after our opening presentation and a discussion among our panelists. So we're going to kick this off now with Francesca. Francesca Castro is a level 3 research clinical dietitian nutritionist at Memorial Sloan Kettering Cancer Center, where she joined the myeloma service in 2021 with a focus on whole food, plant-based diet interventions, working alongside oncologist and advisor Dr. Urvi Shah. Her interests include the impact of dietary choices on both cancer prevention and progression, the gastrointestinal microbiome, and evidence-based clinical nutrition care. Francesca completed her Master of Science in Nutrition and Exercise Physiology at Teachers College, Columbia University, and her Bachelor of Science in Biomedical Science at the University of Central Florida. She is a registered dietitian nutritionist at the Academy of Nutrition and Dietetics and a certified dietitian nutritionist within the state of New York. You are an impressive person, Francesca. Thank you for being with us. How are you?
Good. Thank you so much for that introduction.
Awesome. Well, tell us all about your research. There have been so many amazing studies coming out of your partnership with Dr. Shah. Tell us more about it.
Yes, I'm very grateful to work with Dr. Urvi Shah. As Leanna said, we have multiple Nutrivention trials currently actively recruiting and also opening very soon. So I wanted to highlight some of our findings from these trials, but first I wanted to lay the foundation to how these hypotheses were formed. So given early detection as both patients and providers, we have an opportunity for lifestyle modification to reduce risk. So in the pre-cancer space currently for multiple myeloma specifically, there's no treatment, and once the multiple myeloma is diagnosed, that's when treatment occurs. Dr. Shah had a hypothesis that if we can alter the modifiable factors that affect immune function, can we tilt the scale in development and overall survival and outcomes. So through a plant-based diet, we could potentially improve adiposity, blood sugar, microbiome, and etc. So the magnitude of these disorders in the US are that 70% of people in the US are overweight or obese, 45% are pre-diabetic or diabetic, and less than 5% get enough dietary fiber based on the dietary guidelines for Americans, and 3% of the population over 50 have MGUS and smoldering. And MGUS and smoldering are these precancerous conditions to multiple myeloma, known as the precursor disorders, that can potentially increase risk of developing multiple myeloma. I wanted to give some background in pre-diagnosis dietary patterns and overall cancer. So various studies in the epidemiological space have shown that plant-forward dietary patterns have overall less cancer incidence than those not following a plant-forward dietary pattern. And then in myeloma specifically, vegans and vegetarians and those who consumed plant-forward dietary patterns had overall reduced risk of developing myeloma and also overall reduced risk of MGUS and overall reduced risk of myeloma-related deaths. So you could see here that highly processed foods, specifically in this NHANES study that Dr. Shah did, processed foods actually increased overall risk of MGUS. And then in our Nutrivention pilot, which I'll be focusing mostly on today, we did a whole food plant-based dietary intervention in 20 participants. They had either MGUS or smoldering multiple myeloma, so those precursor conditions, and their BMIs were greater than 25, and they were not on treatment. We provided high fiber plant-based meals for 12 weeks. We provided 12 meals a week, so averaging about 2 meals for 6 days of the week, and then they were given guidance for additional meals and breakfast and snacks. They were encouraged to eat to satiety with no calorie restriction or prescription, and the focus was on minimally processed plant foods as much as possible. So our question for this study was, is it feasible for patients to adhere to a diet like this, and will, in this particular study, will improve body mass index? So our feasibility endpoints were, could they adhere to the diet greater than 70%, and will their body mass index reduce greater than 5% at 12 weeks? I also wanted to highlight our baseline characteristics, showing that we had a similar population to those affected by multiple myeloma. We had both minorities and whites, and then in our BMI, it was evenly distributed, which is similar to the overall population of those affected by myeloma and their precursor conditions. What we found is that this pilot intervention was feasible. Dietary adherence improved. So at baseline, dietary adherence of plant-based foods was around 20%. And at 12 weeks, it was actually at 91%. And then we followed up with those patients at both week 24 and week 52. And we found that the adherence was much higher than it was at baseline, even after the meal period was complete. And then we also found that baseline BMI improved at 12 weeks. So we found a 7% reduction from baseline after 12 weeks, and actually sustained weight loss even after that 12 weeks when the meals were provided. We also saw that the intervention improved dietary quality. One thing I forgot to mention for the intervention is that along with the meals, we also provided every other week nutrition counseling and health coaching throughout the 24 weeks. And at baseline, the fiber intake was around 12.3 grams per 1,000 calories. And at the 12 weeks, it improved to 24 grams per 1,000 calories, showing that this is sustainable for patients because they were able to sustain such a high fiber diet even after the meals were provided through the guidance of the counseling and the health coaching. So even at the 24 and 52 week time points, they were eating much greater fiber than they were at baseline. And then the Healthy Eating Index is a dietary quality score based on the US Dietary Guidelines for Americans. And we saw that at baseline that the score was around 61. This score goes from 0 to 100, and 100 being you're adhering to the dietary guidelines as close as possible. So at week 12, we saw that the dietary quality increased to about 80 points, and then it was improved even after that initial 12-week intervention. And then what we also saw is that the intervention improved overall microbiome diversity. So it improved alpha diversity from baseline. You could see here that the improvement was sustained. And it also increased butyrate producers, relative abundance of butyrate producers. Butyrate is a short-chain fatty acid that has been shown to affect the microbiome and improve anti-inflammation properties and potentially anti-tumor properties as well. And the gut microbiome changes were correlated with BMI and dietary quality, so showing that there is a relationship between these three components, that microbiome diversity was associated with BMI, and microbiome diversity was also associated with fiber intake, and fiber intake was associated with butyrate producers. And then trajectory of disease progression slowed in 2 patients specifically. So we had a 71-year-old man with MGUS and a 61-year-old woman with smoldering, where we had data showing their trajectory, that their disease progression was increasing over time. And then after the intervention, their disease progression actually started to plateau potentially. The reason I'm highlighting these 2 patients was the rest of the patients either had stable disease or low disease burden, or just limited data to track that trajectory over time. And then the intervention overall improved quality of life through survey data. It also reduced insulin resistance, and then it also improved inflammation. So it reduced overall inflammation in these patients. I wanted to highlight one of our participants who kindly gave permission to share this. He, before the trial, was diagnosed with type 2 diabetes and was on insulin for many years, as well as other medications to help manage his diabetes. And through the diet and maintaining a plant-based diet, he was actually able to come off a lot of his medication and manage his diabetes solely through diet. And this is a quote from him saying, "It looked pretty dark back in 2010, and thanks to the trial, he's into the light." And he still is following a plant-forward diet to this day. So just to go over some of the potential mechanisms as to how diet plays in myeloma. So it's the overall, this trial was the first intervention of its kind to showcase the potential of a diet in delaying disease progression in the myeloma population. We also showed that this type of diet is feasible for patients. So most patients were able to stick with the diet through the 12 weeks, all of the patients. And then we also did some feedback, which I didn't include in these slides for sake of time, but we got feedback from the patients as well that the overall diet mostly was easy to follow, that they enjoyed the diet and enjoyed the food. And then it was safe for all patients. There was no related adverse events to the diet. And then overall, as you saw, their dietary quality improved even after the intervention ended. And then their biomarkers in their metabolic biomarkers, immune biomarkers, and microbiome biomarkers all potentially improved as well. And this is just a potential mechanism as to how diet plays a role in these various processes. And then we have some active recruiting trials. So Nutrivention 2 is another trial we're doing in the precursor space. This is a decentralized telehealth 2-week intervention looking at a high fiber plant-based diet versus probiotics versus omega-3 versus curcumin for 2 weeks intervention in 100 patients. And then we're also doing another trial in a larger population of the 12-week intervention in both MGUS and smoldering patients, looking at diet versus supplements versus placebo. And then we are going to be opening up a trial in newly diagnosed multiple myeloma very soon. So if anyone is interested, I have a QR code here and you can email us. And this will look to see if diet influences treatment outcomes and response and overall quality of life. And I wanted to acknowledge, of course, Dr. Urvi Shah, who is our wonderful principal investigator, but also our entire research team, because it takes many, many people to make these trials happen, and we're grateful to everyone. I also included my contact information in case anyone has any questions, and I think we're going to transition now.
Great, amazing. Francesca, what's incredible to me is how not only are you showing great results, but you're showing that people really enjoy this food to the extent that they keep with it and they sustain those changes over time. That is remarkable. and just so indicative of what we've seen also, of course, as we do our work in the community, but just so exciting for a community that is dealing with either precursors of cancer or actively in cancer. Really amazing work. Thank you so much for sharing this. And what a cute cartoon we have over here as well. Thanks for sharing that.
Thank you.
So to take this further, I would like to introduce our additional presenters. For a moment, I'll take Francesca off screen here, but we have two members of Plant Powered Metro New York's Healthcare Advisory Board who are both oncologists and hematologists. For those who are not familiar with hematology, it's blood. And so Dr. Keyur Thakar is the Medical Director of Hematology and Medical Oncology at Phelps Hospital, which is part of the Northwell Health system in Sleepy Hollow, New York. A board-certified and fellowship-trained cancer specialist with a decade of clinical experience, Dr. Thakar was also recently named Director of Lifestyle Medicine at Phelps, a new and comprehensive program that integrates evidence-based lifestyle interventions and therapeutics into clinical care and everyday life. And yes, you should have that big smile on your face, Dr. Thakar, because that's awesome. We are so excited for you. Dr. Thakar has been instrumental in the growth of the hospital's oncology program, and he specializes in a wide range of malignancies, including breast, gastrointestinal, lung, and gynecologic cancers, as well as various benign and malignant hematologic conditions. In addition to his work in oncology services, his new lifestyle medicine program will benefit patients across all subspecialties, support employee well-being, and improve community health. These are truly ambitious and such needed aims for your work, and we're really excited to see where this all goes. Thank you for being here.
And thank you for the kind introduction.
Of course. And in conversation with Dr. Thakar, we welcome Dr. Tarun Wasil, a practicing medical oncologist and hematologist at New York Cancer and Blood Specialists. And he also serves as clinical assistant professor of medicine at Hofstra's Zucker School of Medicine, with immense experience in many different diseases. Dr. Wasil is passionate about immunology, immunotherapy, the biology of cancer, and the impact of lifestyle modifications on disease states. He began his medical career at Government Medical College in India and then completed residencies in surgery and emergency medicine, pathology and microbiology, and served as resident medical officer and medical officer. His philosophy is simple yet profound: treat patients with kindness, listen to their needs, and provide care that goes beyond medicine. We have two really heavy hitter physicians with us tonight. Thank you for being here. Let's unmute you. There we go. Go ahead, Dr. Wasil. Make sure we get you unmuted. Can you grab that there?
Hi, thanks for the kind introduction, and nice to meet you, Dr. Thakar.
Nice to meet you.
So I'm going to let you all comment, first of all, on Francesca's research with Dr. Shah, and then move it into other territory, because there's so much to learn here.
Yes. Do you want to go first, or you want me to start, Dr. Wasil?
You can start.
Yeah. So, no, I mean, it's very impressive to see what Dr. Shah and her group are doing, especially to see the impact of diet on blood cancers like multiple myeloma. So over the years, therapeutic strides have improved the outcome of multiple myeloma, and patients with multiple myeloma are living longer. But unfortunately, the incidence is also rising, particularly among younger people. So Francesca mentioned that around 3% of the population above age 50 have MGUS, which if you look at it, it's not a small number. Like if in a room of 100 people, 3 will have MGUS. And if you look at population above age 70, this number goes to like 5%. But now we are seeing younger and younger population having such findings. So, you know, when we see them, they always ask us what's our risk of developing cancer. And it's around 1% every year for MGUS, and it's around 10% every year for the first 5 years for smoldering myeloma. And, you know, previously they would ask us, then what can we do to really, you know, do something against developing multiple myeloma? And honestly, there was no guidelines. We didn't really have anything to offer to them, except for saying, like, you know, if you're smoking, then don't smoke, have a healthier lifestyle, which is also like kind of vague. So I mean, I'm happy that studies like this are happening. We've gone from in oncology just giving everyone chemotherapy and sometimes not so good news to now having them like work by themselves on their lifestyles. So I'm honestly very interested in seeing the results of the Nutrivention 2 and 3 study and also the myeloma trial that they are doing at MSK.
So I have been participating with Nutrivention study with Dr. Shah for more than 3 years now, and I have seen some patients actually come back and they say that I really like their this uh, plant-based diet. However, the challenges remain because I have several patients who were interested in the trial, but unfortunately they backed off when they heard that it is plant-based diet. They told me that they could not stay away from meat, and that is the challenge, I guess. People uh, who are used to eating certain types of foods, they don't want to change. So far, we have seen observational studies showing so much benefit of the plant-based diet and harmful effects of ultra-processed diet as well as meats. But I think this is the first study which I know of, other than some studies in prostate cancer and breast cancer, which are being done in other parts of the country and world, um, that are showing evidence now that these are really helpful. Uh, uh, you can say that it is a type of medication, new type of medication, but it is helpful, and we can certainly decrease the chances of progression of diseases to some extent. And also, I think it is more important for prevention of certain diseases, which hopefully will see the evidence for from some of these big academic institutions, because they have the power, they have the resources to conduct such studies. And I can encourage my patients to go there and participate in these types of interventions, and that is my role.
Excellent. I'm curious if both of you maybe could help us zoom out more. There are, you just mentioned, Dr. Thakar, some trends in younger people being diagnosed. Are there other trends that you're observing in the field of cancer, either like cancer in general or cancer research? Are you seeing other people following in the footsteps of Dr. Shah's research offering similar kinds of trials?
So first thing about the trends of cancer, we can kind of split the trends in America versus the rest of the world. Overall, incidence of cancer is increasing everywhere. But when it comes to mortality, the meaning how many people who are diagnosed with cancer actually die from cancer, that has been increasing worldwide. But in America, it is on a decline. I think since 1991, it has declined around 34%. And that we attribute largely to like improved screening and excellent new therapeutics that we have to offer. But a disturbing trend is rise in the cancer, especially in women. We all know that now breast cancer is the number one cancer worldwide. And second is we are seeing more and more cancers in younger population, meaning patients between age 15 to 49 years. And this includes many cancers such as colorectal cancers, breast cancer, kidney cancer, pancreas, cancer of the pancreas, gallbladder, as well as multiple myeloma, which is more disturbing because when, traditionally a oncologist clinic, we expect to see people in their like 60s and 70s, and now we are seeing younger people. And contradictory to what we believe, they are not genetically driven. Majority of the cancers we are seeing in younger people are driven by lifestyle. So that's the disturbing trend. And as Dr. Wasil mentioned, that it's not easy for people to adopt a healthier lifestyle and stay with it. And to a partly, we even have the society to blame. We have ourselves to blame because the access to a healthier lifestyle is not easy. If we look everything around, actually there was a study which evaluated like products that you get in grocery stores, and they evaluated around 200 and something, like little over 200,000 products, and 70% of those products were ultra processed, so with like minimal nutritional value. So it's something that we really have to focus on. Some of the risk factors that we attribute to this early onset cancer is excess intake of processed meat, which is actually a group 1 carcinogen in World Health Organization. Other than that, overweight, obesity, substance abuse, alcohol, all of that. There was a study in Lancet which showed that 10 out of 17 cancers that we are seeing in younger people, these are related to overweight and obesity. So this includes kidney cancer, liver cancer, pancreas, and so forth. So a lot has been happening in terms of the incidence, which is like, shifting towards the younger population. As far as research is concerned, what is more promising is in the beginning, we were just trying to throw everything at our patients with chemotherapies to like improve their outcome. Then we started focusing on how to improve the tolerability of chemo and come up with more of a targeted treatments, which we have come up with probably more newer targeted therapies in cancer in the last 15 years than any other field, which has improved the outcome. People who are diagnosed with cancer as deadly as lung cancer are living longer now. But we still have to do more to work on the incidence and try to prevent cancer before it happens.
Excellent. Yeah, I was going to ask you, you mentioned the ultra-processed food issue, and I'm wondering if you can comment on what is it about ultra-processed foods that is, either cancer promoting or helping to, further cancer in certain ways. And then on the flip side, what constitutes an anti-cancer diet? We're talking obviously here about a high fiber plant-based diet, but there must be elements to that diet that are particularly useful in fighting cancer. So I don't know who would like to go first, but Dr. Wasil, if you'd like to maybe jump in here, and then we can.
No, I fully agree with Dr. Thakur that we are seeing cancer in younger people, and genetics is only a small role to play. And it seems like lifestyle with nutrition, and I think there are other components such as exercise as well as relief of stress. Those are other important aspects which I really talk to my patients about, that chronic stress can also cause similar types of inflammation as the ultra processed food. So far as ultra processed food is concerned, I think it is very addicting, and people love it, and that's one main problem which I see with this type of food. And it's easily available, and it's kind of comfort food for people because they don't have to do too much to get that. And it's also cheaper than the fresh vegetables and fruit which we talk about to be consumed on a regular basis these days with the patients. But they like the comfort foods because they are cheaper. And it's basically seems like there are micronutrients are missing. That's one thing. And then it has it also there are so many ultra processed food which have high fructose corn syrup, and that also is very, very damaging to the cells in general. But I guess no one has been able to uh, address that issue at this point, because it is easily available, and it is much cheaper, and it is in almost every nutritional bar you see, cereals we eat or people eat, and it is damaging to our cells as well as our body in general.
Yeah, I would just like to add a little bit. So when it comes to impact on cancers, there is evidence which associates consumption of ultra processed food with certain cancers such as colorectal, breast, pancreas, and lung cancer. And some of the mechanisms which they think about, as Dr. Wasil mentioned, is the nutritional quality is poor. Their purpose is not to make you healthy, but is to make you consume more and more. Make it easily available, better to taste, and then they have harmful additives which cause chronic inflammation, DNA damage, eventually leading to cancers. Ultra processed food also, because of the additives, have been shown to affect the gut microbiome, which eventually leads to cancer as well. And interestingly, some of the packaging material which contains like bisphenols and phthalates and all, which are used in some plastic packaging, they are considered endocrine disruptors and have been linked to breast cancer. Again, as I mentioned, ultra processed food we consume in without any consideration of calories. So this also results in overweight and obesity, and then inflammation, and then consequently cancer. Now, one statistic I wanted to share, which actually blew my mind, is children and teens in America. 56 to 70% of them consume what they consume, and in their entire day is junk. So, and as a matter of fact, throughout across the board, more than half of the calories that we consume come from ultra processed food. So it's kind of mind boggling and concerning.
Yeah.
It's interesting that there are many different ways to achieve the same goal. In Urvi's study in Nutrivention, I have spoken to her and heard her say many times that there was no calorie restriction. And there are other plans where people stress the need for calorie restriction as one of the main things. So there are many different ways. I guess you just have to adhere to some good practice and you should be able to see the benefits. And just a couple of days ago, I had a patient who was a diabetic. She's a breast cancer patient. So I usually talk to them about some of the lifestyle modifications. And she did it, did started 3 months ago. And she came off of all her anti-diabetic medications and she lost about 15, 16 pounds and she wants to lose another 15 pounds. But it was very good to hear that a patient who practiced just for 3 months, she went on a plant-based diet and she is off of her all anti-diabetic medication and still real case.
That's amazing. Yeah, thank you for sharing that. Before we bring Francesca back on, I just wondered if either of you could comment specifically on the animal food side of this. There's obviously so much agreement in the public health and food policy space that ultra-processed foods are problematic, but what is it specifically about the animal foods and cancers? And if you want to go deeper, animal foods and blood cancers, if we know more, that is causing some of these issues as well.
I mean, the strongest evidence with animal foods is actually with colorectal cancer, breast cancer, endometrial lung cancer, and yes, certain hematologic cancers. And there have been like mechanisms that have been like postulated and thought of. One is animal foods generally tend to be more pro-inflammatory, and inflammation we know is one of the risk factors for developing cancer. I always give this example to my patients is. Let's say if you eat a bowl of salad versus eat a slice of cheese pizza. Let's say after eating cheese pizza, if I ask you to like either run a marathon or go to bed and sleep, which one would you prefer? And the same thing when someone has a flu. Flu is a high inflammatory state. People feel sick with flu because they have fever, they have inflammation in the body. If you ask them to run a marathon or go to bed, what would they prefer? So certain foods cause inflammation in the body, and I feel, or actually animal foods tend to have more inflammation. Studies have shown that certain blood markers like CRP are higher when you consume primarily an animal derived diet. Besides, processed meat contains carcinogenic chemicals such as N-nitroso compounds, heterocyclic amines, which are known since 1970s to be carcinogenic. Other thing is animal food contains heme iron. So the iron in animal foods are heme, which causes DNA damage. It causes inflammation, consequently can increase the risk of cancer. And animal foods also have higher saturated fat and cholesterol. So you will never find cholesterol in plant foods. So which leads to obesity, overweight, and again, increased risk of cancer. The last thing which I personally feel, especially with colorectal cancer, is most animal foods are unfortunately antibiotic treated, and that disrupts the gut microbiome. And I feel gut microbiome is actually the CEO of our body. Like our gut microbiome decides how we are going to function overall. So we need to treat it properly.
Very well said. And just to add, prostate cancer is also linked to meats and the animal diets. And I think the way we cook, it is also possible how we raise the animals these days. That also is controversial and maybe resulting in some of the damage, because people have been eating meat for a long time, for centuries, and we didn't see this type of cancer. And the other thing which I have sort of observed in last 35 years of my practice is that the cancer which we are seeing these days is much more aggressive than before, especially in younger people. Even in older people, we always used to think that breast cancer in older people is very mild type, but it's very difficult to judge that these days, because there are patients in their 90s and they have the most aggressive cancer. So it's there's some shift which I again I don't have any evidence for it, but there's I think lifestyle has changed so much, so we observationally you can say that that could be one of the factors.
Yeah, and you know what's amazing for all of you who are on the front lines in medicine, you are seeing things even before we hear about it from research, right? So it's really important to listen to these trends that you are observing out in the field. I want to bring Francesca back on because there's an interesting conversation happening on our YouTube feed in the comments, where there's a question about, of course, we want people to move in more plant-based directions. And one of my questions, especially for Francesca, is, the study design was to give people all plant foods all the time for 12 weeks and to see what happened. And you got tremendous results. Do you think that you will have gotten such great results with more incremental change? Or, what was the thinking behind the intensity of the dosage of the plant meals?
That's a great question. I wasn't at the institution when Dr. Shah was developing the trial design, but the thought process was to provide these meals and make it as easy as possible on the patients. The goal was that 70% of their total calories was coming from whole food plant-based sources. It just so happened that through maybe multiple factors, providing the food, giving counseling, giving health coaching, and meeting with the patients more regularly, that they were able to get on average 91% of their total calories. But there was still a range of patients who had above 70, but maybe closer to 100 or maybe closer to 70. So we still saw benefits in all of those patients, regardless if they were closest to 100 or closer to 70. And I think more research needs to be done to see what threshold really provides those benefits. But I always say, as plant-based as possible. If any of my patients are on the call, they hear me say progress, not perfection. I know Dr. Wasil has heard me say that multiple times before. It's really about progress, not perfection. It doesn't mean every single thing you eat has to be a plant-based food, but thinking about what you can add to the plate to maybe make it more plant forward.
There's some kind of negotiation which we have to sometimes do.
Yes, it's real life, right? We understand. I want to call out from the comments, someone mentioned, this is actually harm reduction work. It's the idea that you can create tremendous benefit and reduce the extent of harm with more gradual change. And yet for some, of course, we know that going much deeper is really important for their health in order to get to the health outcomes that they're seeking. So I also wanted to ask all of you, I don't know who would like to comment on this, but is there a way to use a plant-based diet to help patients better tolerate the traditional therapies that Western medicine offers cancer patients, like chemotherapy, immunotherapy, stem cell transplants? What do we know about the sort of confluence of diet with these treatments, and how can it help?
Before answering, I would like to take that question, but I wanted to make a comment about the previous part. Is it's always good to try to be as much plant-based as possible, and sometimes if you fail, don't take it as a negative and then fall back, because I always say, even when someone tries to attempt to run a marathon, they're not going to run like so many miles on the first day. So start slow, but at least have an aim. don't stop at a certain point, because we do know that more you consume, better is the benefit. And there are the heterocyclic amines, the TMAOs, which come with, like, consuming red meat and so forth. That's really going to affect the gut bacteria as well. So the more you consume, better it is. But don't set like a short term goal. Have a, don't look for a sprint, look for a marathon. And as far as like diets that support treatment, cancer patients treatments, I always say that first thing, and we work very closely with our dietitian at our cancer center, is we always try to understand what is the goal. Are you someone who's trying to prevent cancer? Are you someone who has cancer and is undergoing treatment? Or are you someone who's done with the treatment and wants to make sure cancer doesn't come back? Or the fourth category is, are you someone who has terminally advanced cancer and is having zero appetite and doesn't want to eat anything? And if you really look at the last patient population where they are not eating anything, we really don't have any restrictions. Whatever you like, just go ahead and consume it. Just get some calories in you. But all the other three groups, if you look at whether it's American Institute of Cancer Research, World Cancer Research Fund, NCCN, American Cancer Society, they all recommend eating diets which are more anti-inflammatory and powered by the plants. So more of whole grains, more of vegetables, pulses, lentils, beans. And except I would say, if someone who has had a colon cancer and had a surgery for colon cancer or some GI cancer, there is some restrictions on the fiber which they can like address patient by patient basis. But all in all, these foods have anti-inflammatory properties. That helps in like at least countering exhaustion and tiredness that comes with the chemo. Even when chemotherapy sometimes causes mucositis, which means like inflammation, which can not only present like ulcers in the mouth, but it could be lower down as well. And these foods, they have phytonutrients, which again help in have anti-inflammatory properties and help them. So protein is important, and I feel like we live in a world where protein is over exaggerated. It seems like all we live for is protein, but protein should be a component of what we eat and not the only thing that we eat. uh, so that's what it's a complete balanced diet. Eat something that makes you feel better, move better, and not be tired.
So it's interesting that um, patients who are undergoing chemotherapy, they don't have much appetite and they don't eat much. So in those cases, I think what I have learned from my patients again is that they always tell us that they are juicing, which means that they are basically concentrating their micronutrients into small volumes and they are consuming that. I think that makes sense to some extent. And I encourage them to do that. It has to be a variety of foods, again, 30 to 40 different kinds of vegetables and fruit in a week they have to consume. That's what I tell them, that should be the goal to some extent. And if they don't have much appetite, try to make juices out of them and drink those or sip on a regular basis rather than drinking half a cup or 1 cup at a time. That helps. And there are some data of anti-inflammatory diet helping patients with myeloproliferative neoplasms, which are also blood cancers. And there are the symptomatic relief which people see, such as itching and night sweats. They are reduced in those populations by just anti-inflammatory diet, which Dr. Thakur has talked extensively about just a few seconds ago. So there is an advantage to anti-inflammatory diet, and the way we uh, give to the patients who are on chemotherapy may be different.
That's so helpful. I know the issue that people have of even having an appetite at all during cancer treatment is definitely a big one. And I've heard people talk about, oh, we need to make these replacement shakes and whatever. And you know what? The idea of just juicing the natural foods or smoothies or something that like makes it easier to take it in, it's full of wisdom. And I know, Francesca, you mentioned also the American Institute of Cancer Research and the power of the plant foods that they are touting also from the research. Do you want to comment on any of this?
Yes, the American Institute of Cancer Research has a great resource. I know Dr. Tucker also mentioned World Cancer Research Fund. They have a matrix which actually is really helpful in showing what evidence is available per different lifestyle modifications. So fiber, even exercise, processed foods, all of those things. So you could see kind of all the available evidence in one place instead of having to try to search it all on your own.
That's great. I wanted to ask you, there are, you all are, of course, like moving in the plant-based direction, but there are also some cancer researchers who seem to be going in somewhat opposite direction, which would be toward a more high protein, high fat diet compared to a plant-based diet, which is naturally higher in carbohydrate. And that the opposite is, in effect, a keto diet. And I wonder if you could comment on this dichotomy in the field among your colleagues, in the research. If you want, maybe somebody could kick off with just a little explanation of keto diets in comparison, and then we can comment on its efficacy with cancer compared to plant-based diets.
So whatever I have read so far is that there's an alternate pathway. There's a talk about Warburg effect in cancer, and keto diet is supposed to actually attack the cancer cells and sort of spare the normal cells in a way. And people who really believe in it, they have created some evidence. But again, what I was saying before was that there are different ways sometimes to reach the same goal. And if we can somehow prove that the keto diet is also beneficial in cancer patients, certainly it will be helpful. They will have some choice. But I have not seen any hardcore evidence at this point. Maybe I'll get education from Dr. Thakur if he has looked at any evidence.
Yeah, so firstly, keto diet, which is a low carbohydrate and high fat diet, essentially, as Dr. Wasil mentioned, works by shifting our metabolism from using glucose to ketones. And there is one understanding that cancer cells are less able to utilize ketone for energy, making them more vulnerable to glucose restriction. However, and it has been used like for ages for people who have epilepsy and hyperfunctioning of the brain, hyperfiring of the brain neurons. Recently, some retrospective analysis looked into its use in glioblastoma, which is a brain tumor. But if you really talk about a high level evidence, like using it prime time, it's really not available. Besides, a lot of our patients also say, okay, sugar feeds the cancer, so let's just stop eating sugar. I never recommend refined sugar to anyone. So, but glucose is primary source of energy for our brain and for most cells in our body. So when you're depriving the cancer cells of something, you're also depriving the rest of the body. Actually, would like to say, most of you might know Dr. Michael Greger, and he always comes up with this funny quotes. And he says that not eating sugar to deprive cancer cells, it's like if Hitler was breathing oxygen, then, everyone should ban breathing oxygen. It's something like that. So he's just funny. But anyway, so large scale studies are not there. Besides keto diets, if you look at sustainability, I haven't found anyone who's able to sustain a keto diet. There is a lot of short-term and long-term side effects, including the brain fog, the keto flu, nutritional deficiency. There is higher increase in LDL cholesterol and fatty liver and so forth. So I would, when Liana, you asked us, like, in our physician community, what is the talk about keto diet? Sadly, there is not much a talk about diet in physician community. We rely more on our nutritionists or our dietitians. But some of us do take interest, and To be honest, when people with cancers are already fighting with weight loss and you're giving them a diet which is going to make them lose weight and consume more of a fatty food, which might be the cause of it, I would really want to see a lot of more studies, which are really like high quality studies to show me some benefit before I really adopt it in for my patient population.
And sometimes it's the ethnic background that also has creates hurdles, because I know in our ethnic background, losing weight during especially chemotherapy is considered a sin. Basically, why would you lose weight? So everyone wants you to eat more, and eat whatever you prefer, and that means the more comfort and ultra processed food, and that can be harmful. Can't hear.
Thank you so much. Francesca, did you want to add anything to the discussion on keto diet?
Yes, I have a slide. I don't know if you can present it because
Yes.
I'm having. So Dr. Shah actually wrote a review paper comparing whole food plant-based diets and keto diets in the setting of cancer, published in JAMA Oncology. One thing I want to touch on about the conversation about plant-based versus potentially keto diets is that the mechanism of ketones versus butyrate, which affects the microbiome in similar ways. But as we spoke about today, and as you could see in this chart, is that whole food plant-based diets tend to have different mechanisms. And as Dr. Thakar said, typically a keto diet is not as easy to sustain as a plant-based diet or eating more plant forward. And in keto diets specifically, some of the research shows that not only are they losing mass overall, but they tend to lose fat-free mass. So muscle mass and important things we need for the body to function optimally. Whereas in plant-based diets, some of the evidence suggests that we're losing mostly adiposity, so mostly fat mass, which overall promotes inflammation. So I encourage everyone to take a look at this paper if they have the time. But in general, keto diets in clinical trials, the evidence is limited, where we have a lot of epidemiological data showing us that dietary patterns that lean more plant forward tend to have the best health benefits, not only for cancer in general, but overall overall comorbidity. So things like diabetes, obesity, hypertension, all of those things that all are related and affect cancer outcomes as well.
Really powerful. Thanks so much. Really helpful. And it's so good just to see that we have these medical papers. And of course, it's our job at Plant Powered Metro New York to help translate this for our community. So keep doing all this high level work, and we'll keep bringing it down to the people because we need it. And it just validates all the things that we know to be so helpful for folks' health. I have a few more questions from the live stream that I'd like to offer up before we close. And this goes back also about the question about your colleagues. A few years ago, before I met Dr. Shah, there were very few oncologists who were talking about nutrition, and I do think that there has been a shift. I'm wondering if you have seen a shift as well. Are you seeing more people in the field of oncology promoting plant-based nutrition or thinking about it or talking about it?
I mean, I can talk about, ever since, like I have gotten into it, we have cancer conferences across our two sites, and Northwell has 27 hospitals, and we have, even the system-wide tumor boards and all, and I do bring up sometimes the topics about nutrition, and also there is increasing awareness. And now we are seeing, after so many years, research actually looking into lifestyle. So in colon cancer, we recently, in July, had a huge study based out of Canada and Australia and some European countries, where exercise improves the outcome in stage 2 and stage 3 colorectal cancer. And then, Dr. Shah is mentioning about a paper looking into diet. So I think there is clearly increasing awareness. As I said, the incidence of cancer is rising and mortality is decreasing. So the number of people who are living with cancer is on a rise. So, I think as oncologists, we always feel like treating their cancer is like little over half a battle won, but to have a complete, benefit to our patient, we do have to talk to them about lifestyle. So there is clearly more and more people who are looking into whether it's diet, exercise, stress management, as Dr. Wasil said, avoiding risky substances, which smoking, alcohol. There used to be a question how many alcoholic drinks are safe to be consumed, and since the advisory on January 5th with by Dr. Vivek Murthy, even one glass of alcohol is not safe for consumption, but like we can all choose our own vices, and positive social connection. So these are like parameters that we need to focus on and come up with more studies. But I'm very positive and optimistic, like they have a definite benefit for patients, whether they have cancer or any other chronic conditions.
That's great. Yeah. And chronic stress, I think, is also something was mentioned in the chat here. We certainly, our diets aren't getting better, and the opportunity to move our bodies isn't getting better, but we are also much more stressed as a population. Any of you want to comment on that particularly?
Sure. Chronic stress decreases our telomeres. It depresses our DNA repair pathways. It depresses our immune system. And all these are important to fight against the cancers. And chronic stress can cause any disease, any symptom. It started several decades ago, actually. Scientists from here went to Haiti and looked at the type of diseases. He was looking for malnutrition as one of the main factors. But what he found was that diabetes and heart disease was still very common, and the most common causes of mortality in those patients who were thin, lean and thin. They were not even obese. And there are so many studies done, and they have looked at a genome of about 207 genes. And what they have seen is that chronic stress can depress all the protective genes which make antibodies, and also upregulate those genes which are inflammatory. So there are several studies on that aspect from California. Um, I had written a book about 4 or 5 years ago, Mind Body Crosstalk. And in that, actually, I had reviewed almost 500 papers. And chronic stress is, I think, most underappreciated. Again, it's very hard to study that, and it's very hard to quantify stress. But people who are even athletes, people give examples, they also get heart attacks and stuff. People who are marathon runners, how does it happen? In Monday morning heart attacks, which is a very common phenomena. People are going to work after a long weekend or after a weekend, and they are stressed out about work, and that's when adrenaline and other things, other chemicals, they affect us and cause some kind of emotional disturbance as well as chemical disturbance. And there are beta adrenergic cells, actually receptors on the immune cells, and immune system gets depressed. And there are so many different mechanisms, actually, which have been elaborated in many different studies. But in general, chronic stress can harm us a lot.
Yeah, that's important. And I had heard about even at the time change, when we shift from daylight saving to standard time, that there's a stress there as well that can sometimes lead to cardiovascular incidents. So it can't be underestimated for all health issues. And I think what you've all underscored is how important it is for us to think about strategies that can ultimately lower inflammation in the body. That seems to be the theme here. We can help not only blood cancers, we can help many cancers, we can help lots of cardiometabolic issues that we see throughout the population with a healthier approach to diet, to movement, to stress management. So it's really powerful to have clinicians like you who are leading the charge in making sure patients are aware of this. And of course, running special programs, whether they're research programs or lifestyle medicine programs, to be able to make this bigger and better so more people can hear about it. I wonder if you would each like to offer just maybe one takeaway. What's your one suggestion for people who are listening tonight to wrap this up? Francesca, do you want to kick it off?
Sure. I think there definitely is something to be said about that gut-brain axis. I really think the biggest thing is thinking about one step at a time and seeing what you can improve. Just a small thing, and start small. I think that's the biggest takeaway.
Great, thank you. Dr. Wasil?
Um, Lifestyle modification can prevent cancer, in my opinion, and doing good exercise, eating right, and doing some stress relief measures can help.
Thank you. Dr. Thakar?
Yeah, the one thing I would say is every bite is a choice. So choose the foods that fight for you and not against you. And as much as it can sound overwhelming to change your lifestyle, but think about baby steps and with a long-term goal. If you talk to any one of us who has done it for themselves, they will always say the first few months are challenging, but the results are really worth it. And I always tell my patients that nothing tastes better than what a healthy self feels, so make a healthy choice, and
That's right. So well said. Thank you all for your time and for your expertise and for your pioneering actions on behalf of all of us in everything you do in your medical careers and your dietetics career, Francesca. Thank you. I'm going to wrap this up now and say goodbye to our amazing guests. Thank you all for bringing such clarity to this important and complex issue. The one thing we know for sure is that the body has an amazing capacity to heal, and that when we are able to emphasize whole, nutrient-rich plant foods in our day-to-day lives, we stand the best chance of supporting our immune system and our overall health. As you heard, Francesca and Dr. Shah's ongoing Nutrivention studies are recruiting patients. I'm going to put up on the screen one more time this QR code for anybody who is a new diagnosis of multiple myeloma who would like to participate. Please do be in touch with them about the study. And I was also told that the Nutrivention 2 study for smoldering multiple myeloma is also recruiting now as well. So I'm going to add that to our chat, our comments feed here for those who might be interested in looking at that one. This is so powerful, and of course, it sounds like it's pretty safe. Not very many downsides, especially if you're really open to something that will that has been shown to help others already in this space. Really, really important. I also want to thank my team members, Karina Pierce, Jim Spellos, Hannah Martinez, and Grace Simino for making all of our live stream events possible. For all of you, I hope you'll follow us, subscribe to Plant Powered Metro New York's YouTube channel, or join our newsletter so you won't miss the next event. We're going to put in the comments our website for those who have found us perhaps randomly and would like to learn more about the organization. And I also wanted to call your attention to what will be coming up around the corner, because we're going to be a little quieter in the month of November as we prepare for the return of Plantathon, which is our annual virtual showcase of the amazing power of the plant-based health movement. We'll be back streaming live every night between December 1st and 8th, featuring the voices of plant-based experts, chefs, and lots of other great people from our local community each night of the week. So we hope you'll join us then. Many voices, one mission, health for all. That is what we are here for. And with that, I want to wish you all a great evening. And we hope that you all find strategies to maximize your health, especially if you are on the cancer path and are looking for solutions. We're here to support you, and we would love to be in touch. So please don't hesitate to reach out. Take care.